would you want to call that? If I said what's the specific to its location? What's the name of this epithelium? What do we call the simple squamous that lines a blood vessel? Endothelium, right? So generically it's a simple squamous. Otherwise, if I ask you specifically, you can really see these nice little, there's a really nice, this is really nice, simple cuboidal here. Let's see what else we can see. I think now let's go over here. So it's really handy when I show you something with blood in it, but this is a blood vessel. And again, what is this? What type of tissue is this?
Endothelium.
Endothelium, yes. And we can see, in this case, it's stained also with PAS, and we can see, I didn't point it out before, that nice basement membrane that it's sitting on. And the same thing is true for here. This dense pink line. And what does PAS highlight? What type of molecules? Carbohydrates, remember that? And so we can really see, and I'm going to ask you this detail, but this is that place where we find that shared basement membrane. So we have endothelial on the inside, podocytes on the outside, and here's that basement membrane. And that's that filtration in the kidney where we're filtering our blood. Okay, so let's go down and see what else. This spleen is not an easy tissue to look at. Let's go and look. Well, we just saw cuboidal, another kidney slime in the cuboidal, so we'll go through. Let's look at some simple columnar. And so just for reference, here's a little slice of the intestine. Again, I wouldn't ask you where we are at all. And this is the lumen. This is the center of the intestinal tract. And then our epithelium, of course, is always going to be lining, interacting with that lumen. So and you'll learn what all these kind of structures are. But for our purposes, look at this. This is what we're looking at. This layer of cells here. Okay? And it's going to be continuous. You will see this layer of epithelium totally surrounding the lumen of this tube. So what type of epithelium would you call this?
Columnar.
Yeah, what type of columnar? Simple columnar, right? It's just a simple layer of columnar cells. You see that nice chain of nuclei? And in this case, it's also, PAS staining, so a lot of them won't be stained. They're always going to have why are most slides always going to have that hematoxylin stain? What is hematoxylin?
It's
that basic stain that stains acidic. So why are we always going to use hematoxylin? Because it really highlights the nucleus. That's why, it might say PASH. So it's PAS, and we're looking at the carbs, but the H is a hematoxylin. And it's just a way of saying, here's the nucleus and orient ourselves. So in this case, what we're seeing is, what is this structure here? Does anybody remember? That little glycocalyx or the brush border, all those glycosylated microvilli. And you can see that, you can see that nice pink line here. The basement membrane is not so evident in this tissue, but the basement membrane would be down here. So if we're looking at this, here's this basement membrane area, and here's the glycocalyx. These are just goblet cells secreting their mucus, keeping everything lubricated. And because remember, just because it's a simple layer, simple just means one layer. It doesn't mean one cell type. There are multiple types. Okay, let's go and look at some pseudostratified. Pseudostratified is going to be found pretty much the reproductive tracts, but specifically the male, and then the trachea and bronchial tree. let's go here, let's look at, so, lumen of the trachea, and here looks like a nice stretch of epithelium. So look at this. Here's a nice region. Okay. What is this structure here? It's uncharacteristically thick in the trachea. It's the basal lamina, in the basement membrane zone. It's pretty thick, and I don't, students will ask sometimes, why is it so thick? And I really don't know. One of the thoughts is, what are we doing? We're breathing in a lot, just as kind of a barrier so none of that goes, we want the gases to go and exchange at the level of the alveoli to get into the bloodstream. So it might just be kind of help impeding the diffusion of things. So look at this epithelium. Look at these nuclei. What are we going to call this? Well, you already know.
Polar.
This is pseudostratified, right? All cells, so it's really a simple layer. All cells are sitting at the basement membrane. They just are different heights and different sizes. So it looks very stratified because their nuclei have all these different kind of heights and arrangements. Okay? And what about this here? What are these structures? Little, very regular size little bristles. Not microvilli. Microvilli we won't even see. All we saw was that pink line. We didn't see individual ones. What are these? Cilia. When you see kind of these like real regularly sized bristle-like structures, these are all ciliated cells. Not all of them. There are going to be goblet cells in here. There are going to be some sensory cells, but most of your supporting cells are going to have, and you can see very, very regular. And these are the ones, what's at the core of a cilia?
9 and 2.
Microtubules, right? And these are the ones that have that kind of motility, that movement associated with them. Okay? So let's compare, so you can see that really nice line of cilia. Compare that to this one.
What is that?
This is a pseudostratified in the epididymis. Let's kind of look around. You can kind of see. And as we go higher, let's look at this. Can you all agree that this might be kind of a pseudostratified, kind of multiple like heights of cells? And what are we finding? What are we seeing here? Do these look different than the structures we just saw? Yes, no? Right? Those cilia were very, very kind of regular, kind of like blunt bristles. These are kind of long and stringy.
Stereocilia.
These are stereocilia. Kind of different heights and what's at the core of stereocilia? Actin, right? And what's the so if cilia are to move fluids across, what's the point of stereocilia? Yeah, increased surface area for absorption. Microvilli, the same thing, increased surface area for secretion or absorption. In this case, predominantly absorption. Okay, so I think you have a good handle on the pseudostratified with cilia or stereocilia. Okay, let's go on to our stratified. So here's our non-keratinized. So where do we find the non-keratinized? Oral cavity, esophagus, vaginal canal, right? So let's look at this. So this would be the lumen is disconnected here. Here's a nice region. What are we going to call this? Stratified squamous. And this is what I meant yesterday in terms of, especially stratified squamous, it's always it has a very fast regeneration rate. So, all mitotic activity is going gonna be going on here. That's all, sometimes why it looks real dense. And then cells are gonna progressively move up and stack, right? And then slough off. But what you wanna see is these outermost cells that are falling off are intact cells, right? And you'll compare this in a minute to keratinized, and you'll see that that outer layer that looks like it's sloughing off is all very fibrous. There are no nuclei. Okay, so if you come to an area here, you know, and you have, even though it looks like, don't let it, oops, okay. Where, oh, okay. What, oh. I don't know what's happening. Okay, let me start, okay. Let me know what's happening. Why is this, okay. Well, I need to, pull my, this. So again, even though it looks like, oh, cells are falling off, all of these are intact cells. I don't know why my mouse isn't moving as much, but okay. Let's, while we're here, let me show you something else. So we'll go. Okay, let's look at this. Oh, maybe a lot of y'all are on this too. Are y'all following along? I was like, maybe that's why it's kind of got this lag that I'm not used to. Maybe I should say y'all close your laptop. Pay attention. That might be what it is now that I'm thinking about it. Compare what we just saw to this one. Stratified squamous down here, and look at this material. That's your keratinized layer. And you can see usually the keratinized layer follows the contour of the epithelium, whereas the other just kind of sloughs off randomly. But you can see it's a very, very regular process of making this fibrous. And we only see keratinized epithelium on our skin, you know, in our lips, in the inner regions of our mouth, a little bit, inner regions of our nasal cavity, but otherwise, so like I said, stratified squamous, and really they don't, you know, in the stack they don't look as squamous, but you can, here's a nice patch where they look very squamous-like. Okay, and while we're here, what would you call this connective tissue? If I just had to say, what is this? Dense irregular. And that's what's in the dermis. So don't worry about the names, we'll do skin later, but you know, if we're talking about skin, this is the epidermis, all the way to stratified squamous keratinized, and underneath is just the dermis, and it's a dense irregular. And that's what you can see, this is all dense irregular. And then making our way down, again, very, very thick layers of dense irregular. What would these cells be? These would be fibroblasts, and all of these would be collagen bundles. We'll look at one in a minute that's stained, because there are elastic fibers in here, we just can't see them. And then look at this tissue down here. What about this tissue? That's not a very nice. What happens is, if you had to guess what type of tissue, there's a little patch of it. Adipose, yes. A lot of times it doesn't preserve very well, because the wall is so thin, it's limited. A lot of them burst apart. But that's what we're seeing here. Those are sheets of adipose tissue. So, the dermis is all dense irregular, and the hypodermis is this cushioning adipose tissue. Okay, so that was our stratified squamous, the two different types. So, and then this is just thick skin. Look again, adipose down here. It's a nice preserved adipose, actually. Yeah. Compared to the other one. So adipose, oops. Oh, it's this, what it was. Oh, it's the, let's go up here. Dense irregular connective tissue, and look at this. And this can be modulated, you know, so sometimes people that have, you know, thicker callous skin, that's just a thicker layer of keratin, you know. In the summer, if you're barefoot a lot, you know, your feet get rougher, right? As a protection, because you're barefoot a lot. That's just areas that are responding and making a little thicker keratin versus in the winter, we're putting lotion on, smooth, you know, keeping our socks on. And they're going to be smoother. You might not have as much. And then there's dry skin that's kind of different than keratinized. But also, you know, we can respond. So if you're, I don't know how many of you work in the yard, you go rake a lot, you know, you might blister at first. If you keep doing it, you'll develop calluses, and that's just a thickening. That's just your body responding and making more keratin where we need it. Okay. Stratified cuboidal and stratified columnar. Let's look at, so this is a slice of the epiglottis. And so where do we mostly find stratified cuboidal and columnar? Y'all remember?
Nope.
Glands, right about glands and ductwork. So we're going to look at some of the ducts in this epiglottis. So looking at this connective tissue, can you see, what would you classify this area here? Loose, and then this area here? Dense. This is common as well, especially like in the oral cavity, the lower end of our GI tract and the reproductive tract. What will happen is right under the epithelium, you'll see a little looser connective tissue, and that's where a lot of your white blood cells will kind of be roaming around, and then it'll get denser as you. So there's no like border, but this is real common. That right underneath you'll see kind of a looser, and then it'll get denser. And then when you start seeing things like this, these are just glands. There's a little adipose tissue. So let me look. Let's see what this is. We're going to look at these two structures here. Would you say this is a duct? What would you say? No, look, it's got the blood in it. So there's your simple squamous endothelium. Blood vessel, there's a little blood vessel. All of these are little blood vessels. Compare that though to this. Where did this guy go? Oh, here we go. And you have to kind of think of this as, these are continuums. So usually like if you're saying a duct, it will start out like simple cuboidal, then it will go stratified cuboidal, and then it will like progress to a stratified columnar. So there'll be sometimes where you'll be like, I don't really know what this is. It looks like in between, and it might be. So we'll give you very kind of classic looking. So based on this here, this region here, what might you call this? Stratified cuboidal, right? Kind of two cubes, sometimes three stacked up in a row. You can see them there. Because of the way they're cut, they kind of look like only one stack here. But you can see, you know, they're two kind of sets of cubes, if you will. And we're just going to have to look around and find. This is going to be a blood vessel. These would be blood vessels.
I don't know what a tattoo looks like under the microscope.
Let's see. I'm sure there's a. Because remember, these are all exocrine or endocrine ducts that we're looking at. Exocrine, right? What would this be? A duct? No. A little blood vessel. It's a little arterial. There'll be one here. Blood vessel. There should be something here. All those be different. Oh, there's a piece of one. Slice, but this would be a stratified columnar. I'll find a nicer one for us. Let's see. Did we look all the way around? That's where we started. Stratified cuboidal here. So usually the larger are gonna be, let's see if there's another slide. So if not, we'll find another. I'll find another one for you. How is there not one on here? I'll go and look. We'll look. I don't know. Okay, maybe there's not one on here. Well, that surprised me. Okay, well, I'll pull up another slide in a minute. Let's just move on so we can, in the interest of time. Where we're gonna find, transitional. Urinary system, right? Ureters, bladder, and urethra. So, we're gonna look out here. The lumen, this is all many, many bands of smooth muscle. Here's a nice little area here. What is this type of tissue? Kind of looks stratified, squamous, if you will, but these outermost are very rounded. Almost look cuboidal. But they kind of, you see, here's a nice, and they kind of have this little puffiness to them. Right, that's transitional. Here's a little patch here. And there's a few there. See how they're just kind of these rounded, these are called umbrella cells. Remember, because if this was a stratified squamous, those outermost would be nice and flat. Right? Okay. So, let me just see something really quick. Let me
That's what I thought we were gonna get out of an hour. I think it's like 10 days left till Christmas. Thanksgiving, holiday, days. And holidays.
Let's see, we can find a nice.
Just 2 things. But I don't know when it's area.
I'm not sure where it will. What type of epithelium would you call this? Stratified cuboidal, right? What about these? Stratified cuboidal as well. What about these cells? If you had to guess.
Adipose.
Adipose, yes, this is just a parotid gland, and this is just some cushioning that you see. I thought there might be a
I got some cushioning.
stratified columnar in this one, but I don't think we have a duct big enough to see. We'll find another one. Let's see how we go. Oops. Okay, so let's look, go back to let's look at some of our connective tissue. Okay, this is, in the colon, which I don't expect you to know, but, this is an area of loose connective tissue. This is all muscle. See this? And again, it's kind of a little relative, but you see how loose this connective tissue is. Compared to deeper, it gets more dense. And actually, this material here, in between all of these intestinal glands, is technically loose connective tissue as well. What you'll see here is an assortment of immune cells, some large macrophages, fibroblasts. A lot of these are lymphocytes hanging around. And if you had to kind of think, this is again the colon, if you're just kind of thinking about it, why might you have more immune cells in the wall of the large intestine versus the small intestine? And you see more as you go down. Why would you think that might be true?
It's getting more waste-like.
Yes, because more waste. So like, you know, we're in the small intestine, we're absorbing lots of the things that we want, right? As we go further in the tract, that's things that our body has not taken up. It's going to be waste. And so as you go further down, you will see more immune cells, basically to take up any bugs or debris or anything that's in the system that we might want to protect ourselves against. And so that it is true that you see more immune systems nearer openings in the body. So this is technically a loose connective tissue as well. Okay? And we can't get enough high enough magnification here. Like if we were in the lab, we could go under oil objective. A lot of these cells would be plasma cells, you know, secreting antibody just in case there's something in there that we need to protect against. Okay, so let's see. Muscles and the legs. Loose connective tissue. A nice little blood vessel here. Let's look at this. Oh, here's, yeah, that's probably still a cuboidal the way it looks, but stratified cuboidal. But again, can you see this is a loose connective tissue? More cells, more space, much less fiber. It's on its way to looking columnar, but I wouldn't hold us to it. Okay, here's one, and it's specifically stained for our mast cells, but I want you to see what these guys look like. And I would have to tell you they were stained, so I wouldn't ask you that. But this is skin, stratified squamous thin skin. Where you're going, rat, that's why it's not very thin. And all of these kind of granular looking cells, and that's staining for all those granules that have the heparin and the histamine in them. And so it's just nice because you can see how well populated the tissue is with mast cells. Don't worry about identifying, know their function, but I just wanted to kind of show you how they are populating this. And they're usually found in loose connective tissue. Because if you think about it, if you're an immune cell, you know, a macrophage or a neutrophil or a mast cell, would you rather be in loose connective tissue or dense connective tissue? Loose, because you have more room to run them around, right? Whereas if dense, you're kind of stuck in between the fibers. Okay. Now we won't look at the colon. Let's look at this. No, here. I'm looking for one that's stained. We already looked at this. Yeah, adipose tissue down here and dense irregular. Let's see if we have one that's looked at thick skin. Surely I have one. Do I not have one that's stained for elastic fibers? Let me look. Let me show you what the elastic fibers will look like. tell you it's stained with a Bierhoff's. And this is a stain that will stain elastic fibers. And so what I wanted you to see, so we can really still see stratified squamous, keratinized, and here's dense irregular. And so all of this, you know, those are all collagen bundles. And then this, so in the earlier ones we saw, it all just looked pink, right? Because you would not see individual elastic fibers. So we need special usually it's Bierhoff's. I'm guessing that's what it is. And so you can see the elastic fibers very, very nicely. So our dermis is populated with lots of elastic fibers. That's what gives our skin the ability to kind of bounce back. You can see they're much thinner than collagen bundles. You know, they'll kind of aggregate a little bit. They don't get much thinner than this, where your collagen can really form large bundles. So that's what elastic fibers would look like. Okay, let's look at this. What might you call this? They're just a loose connective tissue. Collagen, stain for elastic, and all of these are fibroblasts. This is a little mesenchymal, so undifferentiated, loose connective tissue during embryogenesis. And we haven't seen dense connective tissue yet. Where is that muscle tendon junction? Let me find it for us. I didn't. Let's see, where is? Actually, you know what, I think. One of the other places we see dense regular connective tissue is surrounding cartilage. So this is a piece of cartilage. Can you see this real dense layer of tissues here? This is actually dense regular connective tissue. Let me get, number 2 is a little lighter. So I wouldn't expect you to know this, but this is cartilage here. And you see how it has this nice little band of cellular fibrous material? This is, can you see that this is dense regular? And you see how regularly stacked those collagen bundles are. Little fibroblast squeeze in between them. So around cartilage, kind of helping support it, you can see it's going to be wrapped. So if you go a little lower, you can really kind of see. This is a nice example of dense regular. So all our pieces of cartilage. Because cartilage is one of that exception that it's not vascular, because it does kind of act as a little sponge compressor, and it's going to be totally surrounded with a nice, what we call, don't worry about the name, it's called perichondrium. But all of those pieces will have, there's probably more cartilage in here, all of these will be wrapped in a nice, dense, regular connective tissue. And then you can see irregular here, very regular here. And that's just the main difference between those two. Okay. So is there anything that y'all want to see again or haven't seen? We've seen all types of epithelium, right? And we've seen the major types of connective tissue, right? Dense, loose, dense, regular, dense, irregular. We've seen collagen, we've seen elastic fibers. We won't look at reticular fibers. You really need to know, you have to know the organ, really, because otherwise they're going to look like elastic fibers, and you might not know where you are. So you should know your fibroblast, maybe macrophage, or plasma cell. Anything else? And so a good guide is, a lot of the pictures, because these will all just be static images on your thing. So a good guide, you can come on here and look around some more if you want. But if not, a lot of them will be very much like the pictures in my PowerPoints. And then also that other website, just to test yourself, that other website that's listed in that first PowerPoint, the one on my departmental CDIV site, that has them broken down by systems as well, just tissues and systems. And like if you go under epithelium, there's labeled and unlabeled. So you can always kind of look at the unlabeled just to kind of test yourself and then check on the label. But those are going to be representative of images you might see on the test. Okay, you had a question? I answered it? Okay. He answered. So if you have questions between now and then, feel free to email me directly or if you want to